Good morning, everyone. We are going to wait a few minutes as people are coming in. We did have 53 registrants, or I think it went up last night. And people coming in now. So we'll give everybody a few minutes here and then get started. I'm just going to put this evaluation link in the chat, and I'll put that in there a few times throughout the program, just so we don't forget. Surprising to see all the snow this morning, since it's going to be 60 degrees this weekend. So we're doing our Michigan thing. We're cold, we're warm. Our snowblowers are out. We're walking. It's sunny. It's warm. Shall I get started, Haley? Do you want to wait a few minutes for people to come in, or shall I start?
Oh, no, we can wait a couple minutes. It's 9 o'clock right on the dot. So maybe just wait at least till 9:01 or 9:02.
Okay. And if anyone's driving in this, we know they need a few minutes. Good morning, everyone. As you enter, we're just waiting a few minutes. As people roll in, we're going to get started in about 2 minutes. Just give everybody a chance to get in late. And we've hit 20 people. Good news. It's a great idea, Haley. And you are going to have office hours, is that right? You've decided to do that?
Yes, I'll talk about that at the end.
Great. That's a great idea too.
Yeah, so I'm going to go down the list because I see many colleagues and friends. So Dr. Ariel Washington, good morning. Cynthia, I think it's Dr. Cynthia Bell. Hello, Brittany. Dr. Felicity Harper, Dr. Jimping Zhu, hello, good morning. Dr. Kenyatta Cole from the National Council of Negro Women, thank you for joining. I see people from our office, Dr. Kristen Mackey. Glad you could make it because I gave her sent her this invitation last night, so thank you.
Short
Lisa
notice.
Tsai from St. Patrick's Senior Center, great partner, thank you for coming. Megan Landry, American Cancer Society, thank you. Molly Marco, hello. Dr. Wren, I need to catch up with you soon. How are you? Good morning. Dr. Mayhas, thank you for joining us. Dr. Ramona Benkert, thank you so much for joining. Rhonda Daly, who basically I scheduled this around her because she really, really wanted this. So thank you. It's a good thing that you're here. Dr. Zimmerman, Dean of Research for the Nursing School. Good morning. Sabrina Mayhew, Shoma Paul. Okay. Good morning, everyone. Hope everybody feels seen. Yeah, I'm sleep deprived and over caffeinated, so it's going to be a good time.
It's a good start. Okay, well, welcome all. We have 25 attendees, and we'll
29.
do 29. Great.
Yeah, good, cool, awesome.
Great. So we will get started. I'll do just a introduction of Haley and then hand it over to her. So good morning.
That reminds me of Romper Room, Felicity Harper. Yeah, I guess so.
So just so everyone knows, we will be recording this workshop and we will share the video with everyone that registered for the event. So we'll send out an email after this and we will share the slides. Are we going to be sharing the slides, Haley? Would that be okay?
Yeah, after this, I'll make a PDF and we'll send it out to everyone.
Okay, great. So we will attach the slides. We will share the recording of this session so everybody has it. I asked a few people that said they couldn't attend to register so we could make sure that they have the video recording. I also am going to ask everyone to fill out an evaluation at the end, and that really will help inform future programs. And so I should introduce myself. Who is this? My name is Carrie Leach. Good morning, everyone. I am an assistant professor for research at the Institute of Gerontology at Wayne State University. I'm also the program manager of the NIEHS Center here at Wayne State University and the program manager for the Community Engagement Core there, and the Associate Center Director for Community Inclusion for Checkup that Haley will, I'm sure, introduce a little more deeply. So let me introduce our speaker today, who is going to take over. Haley Thompson is a professor of oncology at Wayne State University School of Medicine and the inaugural Associate Center Director of Community Outreach and Engagement at Karmanos Cancer Institute, a National Cancer Institute designated comprehensive cancer center. She also serves as founding faculty supervisor of Karmanos' Office of Cancer Health Equity and Community Engagement. You'll hear that acronym OCHE. Am I saying that right, Haley? OCHE?
OCHEEK.
OCHEEK. And is founding director of the emerging Wayne State University Checkup Center that I mentioned. And that acronym is the Center for Health Equity and Community Knowledge in Urban Populations. Her research addresses disparities in cancer care and outcomes through community-based research. And that includes the development and testing of culturally targeted interventions. As a principal investigator and project lead, she has received over $10 million in extramural funding from the National Cancer Institute, National Heart, Lung, and Blood Institute, American Cancer Society, Department of Defense, Patient-Centered Outcomes Research Institute, which she's going to be sharing those great experiences today, and other agencies. And she has received additional funding and as co-investigator and collaborator of other grants. She led the development of the group-based medical mistrust scale, that's the GBMMS, widely used in health disparities research, administered in almost 100 published peer-reviewed studies, so that's exciting. And then has been administered as part of numerous studies resulting in peer-reviewed publications and presentations. She is founded and currently directs Michigan Cancer Health Link, and we'll hear about that today, which is also a process I've been able to be a student of in my own PCORI letter of intent that she's helped support me to submit successfully, because I've been invited to submit an application. She founded and currently directs Michigan Health Cancer Link, a community academic partnership to build research capacity in diverse communities with Karmanos' 46 county catchment area with 130 community members actively contributing to the Karmanos' research agenda. It's a heavy lift. She has a lot to share and a lot of wisdom. So I will just say good morning to everybody and turn it over to Dr. Haley Thomas.
Okay. Good morning, everyone. I'm just going to share my screen and start my slides. I always have to go through this. So good morning. Thank you for joining today. I first just want to start with thank you. So thank you, Carrie, for that introduction. You know, Carrie is really one of my partners and collaborators in this new effort for Checkup, the Center for Health Equity and Community Knowledge. I just really value her contributions. I think, you know, in Wayne State University, she's just really a key person and someone you should know when it comes to community engagement and community engaged research. So I'm really grateful to be working with her. I also want to thank members from our Cancer Center team, Forrest Hosey, for pulling together and hosting all of this as a webinar. Shoma Paul and Chris Johns for helping to spread the word, our Checkup team, Asha Freeman and Ali Faki and Jasmine Shaban and Tanina Foster. And Julie O'Connor also from the Office of the Vice President of Research. So thank you all for making this happen today. So I have a lot to cover and I'm going to jump into it. So we're going to be talking about PCORI Engagement Awards. So as we go into this, so everybody can hear me okay? Everything's good?
Sounds great.
Okay. So first, I want to talk a little bit about my work because that I think is very connected to the PCORI engagement opportunities I'll be talking about today. I'll talk about my newer role a little bit as director for our emerging Center for Health Equity and Community Knowledge in Urban Populations. And the goal of this initiative is to really accelerate academic community partnerships towards health equity. So again, as I talk today, you'll see why this kind of workshop is really important to the work we hope to do through Checkup. but the roles I've been in longer are those affiliated with the Cancer Center. I'm Associate Center Director for Community Outreach and Engagement and help to oversee our Office of Cancer Health Equity and Community Engagement. And we always say as a shorthand, our role there is to connect our scientists to our communities and our communities to our scientists. We really are charged with making sure that the needs and the disparities that we see in our catchment area at Karmanos, which is a 46 county catchment area, are reflected in our science. So that means there has to be bi-directional communication between our community members, our community organizations and those partners, and our scientists and researchers. So again, and really a lot of what we have built through our Office of Cancer Health Equity, we were able to do through PCORI Engagement Awards. We would not have been able to do it, I don't think, without PCORI Engagement Awards. And just to share, like part of the, at the heart of our work is this Michigan Cancer Health Link. We convene these cancer action councils. They're groups of survivors, advocates, and caregivers who want to make a difference in terms of reducing cancer burden in our region. And they represent different populations, different communities, different neighborhoods. And the goal there is to increase capacity around research in our diverse communities, amplify community voice in our research, and then move and work with them and collaborate them on actual research projects. So as Carrie mentioned, we currently have 130 members across 10 cancer action councils across the state of Michigan. And also not included in the table is a more recent Genomic Research Action Council, which was funded in 2020, not 2021. But I'll be talking a lot about that as an example, because I want to provide concrete examples of how maybe to respond to different topics with as part of your engagement award application. So I just want to talk about, I've been involved with a lot of engagement awards, 3 of them as project lead. So they don't have principal investigators in these engagement awards. They're called the project lead, and you can have up to 2 project leads in an engagement award. So Preparing Detroit Communities to Advance Cancer Research was the first one that we received in 2016. We followed up with Partnering with Sexual and Gender Minority Communities to Address Cancer Disparities in Detroit in 2017. And I work with others. I'm sorry, I don't have Dr. Elizabeth Towner. I apologize. I left her name off. I'll include it in the PDF. She adapted this model to address early childhood obesity. We work with Dr. Jinping Zhu, who's on the call, to focus our efforts on Black men and the development of a cancer health equity research agenda. We received then with Dr. Zhu enhancements around COVID-19 to work with community members around COVID-19 research priorities. And then most recently, we have this work that's ongoing, building capacity in Detroit's African-American faith community to advance genomic research. So here I'm going to put in a disclaimer. So, you know, I'm doing this presentation. I have a lot of experience doing this and familiar. However, PCORI changes its guidelines and resources on an ongoing basis. As I was preparing this presentation, it was really interesting to see how much had changed between, 2015, really, which is when I wrote the first engagement award, and 2020, which is when I wrote the most recent one. But even between 2020 and today, 2022, a lot has changed. And I'm going to focus on that a little bit in the presentation. So do not rely on this presentation alone as you're preparing this, as you're preparing your application. And please don't blame me if there was something that you missed that wasn't covered here, because the thing is, PCORI is always updating this information. You can find so much on the PCORI.org website. It is an information-rich, an information-dense resource in terms of preparing your applications and learning more about what they do. I'm going to talk a lot about that. You really need to dive into PCORI.org and the website to understand PCORI's mission and what they want to see in their applications. It's really, really important. So always identify and review the most up-to-date information for PCORI. And as always, and this is with any grant, some things I'm going to talk about are relevant to any application. Read your award announcements or the call for proposals carefully, thoroughly. Go through it with a fine-tooth comb, make notes, use a highlighter. That's really, really important, because you'd be surprised at what you can miss. And I'll talk about things that I've missed even as I've done this work. So again, I know some people this is going to be recorded. If you're watching this 6 months from now, you got to go and catch up with the guidelines. So what is the Patient-Centered Outcomes Research Institute, or PCORI? I'm going to spend a lot of time talking about PCORI and what they do, because it's really important that you really understand their mission as you prepare your engagement awards. And it's going to become clearer and clearer why that's important. So PCORI is an independent, nonprofit, non-governmental organization that was authorized by Congress as part of the Patient Protection and Affordable Care Act of 2010. And so they fund two kinds of awards in general. They fund research awards, and I'm not going to be talking about the research awards. That's a whole different animal. I'm going to be talking about their engagement awards. So it's a different thing. But in general, their overarching goals are to increase the quantity, quality, and timeliness of useful, trustworthy information available to support health decisions. And I'm kind of have some things bolded in italics for a reason, because these are words, when you go to their website, you can see them repeated over and over again. Speed the implementation and use of patient-centered outcomes research, PCOR evidence. Obviously, that's part of the name of the agency, so that's important. And influence, the third goal is to influence clinical and healthcare research funded by others to be more patient-centered. Okay, so that name, that it's coming up again. So hopefully you're getting a sense of what the mission is, you know, what they think is important. So let's even dive deeper into that. They pride themselves on, this is newer. So some of this branding and some of what is on their website now has definitely emerged over the past couple of years, even the past year. Research done differently, right? See that little R? It's even trademarked, right? This is branding. This is their identity. This is very important in terms of to know in terms of understanding their values and what they think is important, right? And they feel that they take an unusual approach to research, one that focuses on research topics, questions, and outcomes most important to patients. Patient-centered. They want to work closely with a range of healthcare stakeholders, not only patients, but clinicians, healthcare systems, payers, to guide research funding. And their work requires that patients be engaged, right? They really have actually a mission to change the culture of research, to make it more engaged when it comes to patients and other stakeholders. That's really important to know. And when I talk about, you know, their website being very information rich and information dense, you'll see different versions of this message over and over again. So again, I encourage you, dive deeply into that website, take a look at all the different materials they have, start getting used to their language, start getting used to their jargon, and start using their jargon as you write your applications. And so this again is all about patient-centered outcomes research, or PCOR. PCOR is a very particular type of research that assesses the benefits and the harms of interventions to inform decision-making and highlighting comparisons and outcomes that matter to people, right? So again, you're seeing why engagement is so important in their work. They also prioritize comparative clinical effectiveness research, also sometimes called CER, that's the acronym, that aims to determine which healthcare options work best for which patients, given their needs and given their preferences, right? So it's a lot of this work can focus on interventions and treatments and services that we offer patients and making decisions around those areas. The goal is to help patients and those who care for them to make better informed decisions. Okay, this is really important to understand, even with your engagement award. So what is PCORI? How does PCORI define engagement in research? They define it as the meaningful involvement of patients, caregivers, clinicians, and other healthcare stakeholders throughout the research process. Oftentimes, and a lot of this, I know there are a lot of community organizations and community members on the call. So forgive me, because a lot of this, sometimes I have to kind of reinforce these messages for our academic researchers, because for many of us, this is foreign in terms of collaboration and understanding this. So forgive me for that, but it's really important. Oftentimes as researchers, we want to bring in our community partners when we want to, most often when we want to recruit participants to our studies, right? When we want to, at a later stage, when the study's already been developed, it's already been started, and then we know that we're not going to meet our target sample size, our target population, right? For recruitment, that's what happens a lot of the times. And again, PCORI wants to change the culture of research and start to introduce community stakeholders at all different levels of research: the preparatory phase, agenda setting and funding, the execution phase, study design and procedures, recruitment, and so on, and then the translational phase. What happens after the study? How do you disseminate your results and your findings? How do you implement, you know, your discoveries? Right? This is what this means. And you see on the side here, you know, this can represent a lot of very specific areas within these broader domains. So again, I'm going to be talking today about the Eugene Washington PCORI Engagement Award Program, which provides a platform and funding to actually increase patients and stakeholder engagement in research. It's really a blessing when I think about it as a mechanism, because it literally funds the building of partnerships. It literally funds that kind of groundwork you need, the time that you need to build partnerships and to build collaborations. It's really a gift. But you can see that they recognize that this is important. If you want to do patient-centered research with high engagement, they understand that you need time to build and build engagement and build relationships. So it's very smart what PCORI, how PCORI has set this up. And here on this this image is from their website in terms of how patients and stakeholders can be involved. It's not limited to this, but again, they show across kind of this research process continuum, the different ways in which community partners can, communities, patients, different stakeholders can be involved, okay? So the engagement awards, there's 3 different categories of engagement awards. There's a dissemination initiative, which is up to $250,000 for up to 2 years, which funds initiatives, not conferences, but initiatives to disseminate PCORI-funded research, evidence, published findings, systematic reviews, and evidence updates. I'm going to go all the way to the right here, stakeholder convening support, up to $100,000 for up to 1 year. That funds multi-stakeholder convening meetings and conferences that include different stakeholders. And again, it has to be around patient-centered outcomes research. I'm going to be focusing a lot today on capacity building. Those are all of the awards I've been involved in have been actually capacity building awards. And I'm going to focus a lot today on the letter of intent, or the LOI, and you'll see why. But capacity building is up to $250,000, up to 2 years. It funds projects that help communities increase their facility with an ability to participate across all phases of the PCOR and CER process. And again, I have a nice slide here. PCORI has, they have a lot of promotional slides on their website. They have everything on their website. And I'll give you a little example of that in a moment. So again, this is an overview. The next letter of intent is April 4th. So it's coming up very soon. And I'll talk about their process, a little bit of review, because you have to have that letter of intent approved before you can actually apply. You can't just apply, you have to approve your letter of intent. That's due July 11th for the start date, if you're funded, for December 1st. Again, here are the different areas. And this year, they have a special, or this cycle, I should say, this April cycle, they have a special area of interest in terms of maternal morbidity and mortality and intellectual and developmental disabilities. This does not mean you can't propose other areas. You can. They just want to make sure that they get applications, so they're really pulling for applications in these areas. Okay. So let's talk about eligibility. Applications can be submitted by, private sector organizations, nonprofit or for-profit organizations, public sector organizations, including hospitals and healthcare systems, any unit of local, state, or federal government. Obviously, like most most of the grants that I'm used to in terms of research, individuals are not permitted to apply. Organizations apply for the grants. So, many people here on this call and the organizations you represent, you'd be fine in this area. So let's talk about the review. Right. So again, the first step is the letter of intent, which must be submitted first. Right. And that letter of intent, you'll see, is really important. The letter of intent, really, you are really actually mapping out your actual proposal. But take a look at this. So let's take this cycle. So this is due now April 4th. 2022, right? PCORI will then review within 60 days. That means we get that feedback around June 4th. They may give you some feedback around that time. If you don't get it approved, they'll give you some feedback. If you do get it approved, they may give you feedback that you want to consider in the application. Then the full proposal submissions are by invitation only following approval of the LOI. That's due July 11th. So look at that. So it gets approved on June 4th. It's due July 11th, right? What does that mean? That means you need to start writing this application far before you even hear about the approval. You got to get started, because between 1 month basically is not a lot of time to get this together. You have to be working on this even after you submit the LOI, even before you hear about approval. Right. So that's important. PCORI may request additional information even, after you submit a full proposal to clarify. And they aim to, I have never seen this happen, but they aim to provide a final approval decision on a full proposal within 90 days of the submission deadline, which is something that makes this whole process very appealing compared to something like the NIH or some other agencies, which take, the better part of a year. It takes months and months to get any feedback. If it's approved, you have to consider contract negotiations, and that can take 6 to 8 weeks. And I'll talk a little bit about that. Engagement awards are not a grant, they're a contract. And I'll talk a little bit towards the end about what that means, because that has some implications about, how you plan things, Really important here, this review at the bottom. The LOI and full proposals are reviewed by PCORI's engagement and contract management and administration teams and internal and external subject matter experts as necessary. So understand that it's being reviewed by PCORI staff. right? But people who work for PCORI. That means, again, these are people who are invested in organization. Again, they're invested in the mission, the values, they know the jargon, they know the materials, right? So understand the audience who is reviewing this. It's not external people who, may not, can maybe loosely affiliated. No, these are people who work for PCORI. So they're going to review your LOI for responsiveness, right? Then that's kind of the first pass. And it's really important to review. There's a longer list than this, but it's really important to review the categories of non-responsiveness, which can include engagement in research that does not specifically involve patient-centered outcomes or comparative clinical effectiveness research. It has to be directly connected to PCOR and CER. That's really important, which is why I spent so much time talking about what those things mean. Projects solely intended to increase patient engagement in healthcare or healthcare systems rather than healthcare research. So this has to be engagement towards research, really important. Projects to design or test healthcare interventions, they do not fund, this is not to fund a research study. And I'll talk a little bit about that. You can have data collection embedded in the project, but they're not funding research studies. It's not the work focused on, your project can't focus on payment or policy recommendations or guidelines. You're not recruiting. This is not a project to recruit and enroll patients for clinical trials. And again, the people who are reviewing this are very savvy. So pay attention. Develop or the maintenance of a registry, a recruitment to participate in a registry. I once didn't see that and didn't take note of that. And I submitted an LOI for a registry and it got rejected. Writing research proposals or completing grant applications or grant making. And then projects focus solely on the social determinants of health with no focus on PCOR or CER. Okay, so hopefully I'm repeating this over and over again. You're getting the theme, right? More, they're going to look at program fit with your LOI, your project plan and timeline, the qualifications of your team and organizational capabilities, your engagement plan and collaborators, and I'll say a lot about that, past performance, budget, cost, and proposal. And they're also going to look to make sure that your grant or your proposal is not redundant. You need to go and look at the engagement awards that they have funded in the past and make sure that what you're doing is going to complement what they already have. They know their portfolio, and they intend to balance their funded portfolio to achieve synergy and avoid redundancy where possible. So again, do your research. So as you prepare your LOI, again, make sure you fully understand the scope of PCOR and CER. Again, it's a very transparent website. Tons of information. You can see all the things they funded. You can go look around. You can see, the kinds of work that represent PCOR and CER. But in your engagement award, your project has to demonstrate a clear connection to PCOR and CER. Engagement awards, again, do not support research studies. Again, as I said, though, data collection might be embedded in the project. It's always a good idea, no matter what grant you're focused on. I don't care if it's from a foundation or the NIH. Contact the funding agency, contact the program officer to discuss what you want to do, right? And so I have the email there, and you can find it on the website. Also, I'm going to just show you here. I'm going to try to, oops, sorry. I'm going to try to move this something over here. Cool. Carrie, can you let me know if you can see this website?
Looks great.
Okay, so I'm just showing you, this is like PCORI's website. You will find multiple websites, multiple PDFs, even on one topic. They'll have different versions of information on the same topic. And sometimes it's important to look at all those different versions because you might find something and get information from one version that you don't see in the other. Matter of fact, as I was preparing for this, I was getting lost in just the tons of information that they have. So this is for the capacity building, the April 22 cycle. I'm just going to scroll down. They got lots of videos. They love videos. This is the categories of non-responsiveness. I'm going to go all the way to the bottom and show you this, just some of their resources, applicant resources. I'll mention this, they have office hours coming up that you can join to learn more about this. And they have things that are already recorded to talk about this opportunity. Look at all they have, all the links, preparing your LOI, preparing your full proposal, all the proposal templates, and then additional applicant resources. Tons of information in here. It's here for a reason, right? Again, they're very clear about their mission. They're very clear about their identity, and all these things represent that. So you need to get familiar with it. Okay. Now, I mentioned that they already have a recorded applicant webinar available. There's a link there. And again, I'll share this with you when we send out the PDF. They're also about to host an upcoming virtual office hour on March 14th that you can put, where you can ask further questions about this work or this opportunity. So let's keep going. Okay, so the capacity building category, I'm talking about this in particular, but I think that what we'll talk about will have relevance to the other engagement award categories as well. And again, I'm focusing on the LOI because what I'm going to hopefully demonstrate is that if you map out a successful LOI, you've basically mapped out a successful proposal. And you really need to put a lot of work and a lot of give your LOI a lot of attention and be careful with it. So capacity building category, they fund certain priorities, projects and projects that support organizations with strong ties to different stakeholders who have a connection to, expertise in, or lived experience related to the focus area, whatever your topic is. For me, a lot of times it's in cancer, to equip them to engage as partners in PCOR and CER. And again, a lot of my projects have focused on this in particular. How do we build capacity and support kind of skills and knowledge within our community stakeholders so they can partner in our research? But they also prioritize projects that strengthen the skills of researchers to be better partners. And that's something I would love to take more advantage of in the future. They support projects that support the adoption or expansion of existing engagement tools and resources whenever possible, rather than develop new products and tools. And we will revisit that soon. I really appreciate this about PCORI because a lot of people in my field think community engagement is sort of low-hanging fruit. They don't understand there are best practices. There's evidence supporting this work. It is a science, and there is science to community engagement. And I think PCORI respects that, and they want to see that reflected in the proposals that they fund. So they're calling people to just, sometimes people think engagement is just sort of getting into a room and talking. No, if talking kind of moved us towards eliminating health disparities and moved us towards health equity, we would have it by now. It takes more polished strategies than that. So again, well, I'll revisit that. And again, another important thing here at the bottom, the information and learnings generated by engagement award projects must be transferable. They must be of interest or use not just to the applicant organizations, but to others doing related work. So I just want to give you a little snapshot of the PCORI submission portal. Register early, please. Just go in there, take a look around, because you can see all the background work, like what they need from your institution and your university, your organization. There's a lot of background documentation that they need. So you want to give yourself enough time to find it, like give us a list of your board of directors. That they ask for that kind of thing. And you just want to be able that you have that in advance. And also just look around just to see, how it's set up. You don't want to wait till the last minute to kind of start filling this out for many different reasons. So I want to go use, as I move forward, I'm going to go through the LOI and some of these tabs and some of the key things within these tabs. I'm going to use an example of the most recent award that my team has received. Again, we received this as funded in 2020, Building Capacity in Detroit's African-American Faith Community to Advance Genomic Research. Before I did this, I went and I looked on the website. I was actually quite surprised to see they had not funded very much, only maybe 1 or 2 projects that dealt anything with genetics or genomic research and building community engagement in genetic or genomic research. So I knew that this could help, again, balance their portfolio. So again, take a look and see what they funded in terms of engagement awards. So one thing I want to mention is that we developed this LOI proposal after meeting and exploring a partnership with Bertram Marks, who was a co-leader of the Faith-Based Genetics Research Institute, which is a community-based organization based in Detroit and Washington, D.C. And they've done other programs in other parts of the country. And their goal is to increase mostly African-American, but participation in genomic research and genetics research, largely through churches, but just increase African-American participation in healthcare and medical research in general. So I want to point this out because we had already met and we had already connected and we're already exploring partnership before working on this proposal. So this proposal wasn't the result of an ask. And I want to point this out for our researchers. And I know our community members out there know this too. And I've been guilty of it, that, we reach out and rush out to you like, a month before we have something due, right? Our application is due or a proposal is due. And we ask for your support and your involvement and a letter of support, and I know personally, and I hope many of my colleagues are trying to shift that, where we try to kind of build relationships first, and then that hopefully will organically lead to opportunities for funding. So, but this particular proposal wasn't a result of an ask. It was organic, like I said, because we were already trying to partner. I also want to mention that, interestingly, yes, this proposal the focus of it anyway, it's not part of my own research agenda. I don't do necessarily research on participation in genomic research or even participation in clinical research trials. I do, like years ago, I have done research on like genetic counseling and testing among Black and Latino women. And I sat for a number of years on an NIH study section that reviewed studies on kind of the social, ethical, legal implications of genetic research. But today, this is not research that I really do. I wouldn't call it like one of my primary research interests, but I did it anyway, because it could help to build partnership with my community partner, and it could help provide resources to building the partnership and also give funding directly to the organization. In my mind, when my community partners win and get funding, that's a win for us too. We cannot partner with other organizations if they're not strong, right? And they don't have the ability to do this work. So I did it anyway. So let's go into the tab organization and project lead details. So I'm just highlighting some things here and I'm going to try to pull from my actual LOI to kind of give you examples. So project lead and project team's previous experience. So you have to describe your experiences similar to this project, including PCOR or CER experience. You only have 2,000 characters. I wanted to mention that too, which is maybe like what, half a page or something like that. So you need to share your project lead's experience, your team, and your organization's experience. So for people at Wayne State, you can talk about what happens at Wayne State. You can talk about the work that I've done or my colleagues have done, right? And for other organizations, you probably, community organizations probably have ample examples of this, but you have to talk about your experience successfully engaging stakeholders and communities and provide examples of successful engagement efforts, and also focus on any PCOR or CER experience if you have any. So here's a note from me. I put the LOI pieces in italics, and then the ones that are the pieces not in italics are me. If you have no experience this is again for my faculty members or academics, if you have no experience with stakeholder community engagement, you can identify co-leads or collaborators who have that experience. So certainly round out your team, but start connecting with community partners. And it can be, having a few meetings over coffee. Start talking about ideas, start talking and just exploring where your interests are aligned. It can be that simple, but it can still count. Again, I mentioned here, if you're Wayne State, just a reminder, we have a lot of breadth and depth of engagement across our institution. So draw upon that. But this is a newer requirement for the LOI. So I don't have a piece. And this is only in 2020 I wrote this LOI, my LOI, right? So even from 2020 to 2022, they're asking for more information. They're drilling down, they're getting more detailed. So I don't have something ready, kind of already completed to show you, but I just at least wanted to emphasize this. It's a newer requirement. The leadership plan is also a new requirement, but I think it's pretty straightforward. But, again, I just want to highlight that because we want to talk about that. And you should consider making your community partners co-leaders, project co-leads, something to think about, right? Organizational summary. So now here's where I start talking about what I actually wrote for my last LOI. Summarize the organization's history, capacity, and mission in a short paragraph. So people from Wayne State, feel free to use what I have. And for everybody on the call, I'm going to be having office hours as part of my role with Checkup. And so feel free to reach out to me. I'm happy to review what you have, happy to brainstorm with you. I'm happy to kind of give you feedback. So here we just basically, some of this is from the website. You can just find the stuff about Wayne State, but I want to show, I highlighted when I wanted to focus. I focused on the fact that Wayne State is, has a very high research activity designation by the Carnegie Foundation, because I want to show that, hey, this is an organization that has capacity to engage in patient-centered outcome research. So I wanted to emphasize that, and also highlighted below, Wayne State University is one of only 10 public universities in major cities in the United States to receive from the Carnegie Foundation the highest ratings for both research intensiveness and community engagement. That's something you want to highlight for an engagement award, right? Cool. So just giving you a sense of that. So let's dig into another tab in the PCORI portal, the project summary. Just checking how I'm doing on time. Can keep zooming ahead. Background. So state the problem or the question the project is designed to address. So here I talked about how genomic research is really important in precision medicine and how it's really important to outcomes. And I also talked a lot about the underrepresentation of African Americans in genomic research. So very clearly, I say we propose to address these issues by expanding 2 engagement tools we have used in the cancer context, PCORI funded tools, by the way, because I've done this kind of work before, the HealthLink model and the Building Your Capacity curriculum to increase African-American engagement in genomic patient-centered outcomes research. So again, when I write grants, I look at the RFAs, the calls for announcements very carefully. I look at the language they use, and I often give that language right back to the funding agency. And you will see this over and over again. you know, again, you got to kind of get in sync with PCORI's jargon and their values and what they prioritize. Next in LOI, explain the proposed solution. This is very funny. I'm always tickled by the fact there's a little pull down piece in the portal where it says, you describe the problem, and it asks you, do you have a solution to the problem? Yes or no? Like, why would you be applying for the grant if you didn't have an idea about what you wanted to propose a solution? So you say yes, and then they ask you, what is your proposed solution? And so I have 1,000 characters. Now here, actually pay attention to detail. And some of this was not there when I had to do this the last time. Explain why it is believed that the solution will work and be better than previous solutions. Describe how the solution will be achieved or is at least achievable. And we wrote that we're going to work with African-American churches because we had a partner for the Faith-Based Genetic Research Institute. We said they have untapped infrastructure to reach different goals. And we want to partner with FBGRI to expand two of our engagement tools from cancer-related PCOR to genomic PCOR. So look at how I'm going back to their priorities. They want to see the use and expansion of PCORI funded engagement tools, right? So connecting it right back and using PCOR, talking about it's all going back to PCOR. And then, you know, at the bottom here, you can see that we want to increase awareness of genomic research, increase genomic literacy, and increase the involvement of African Americans. Again, these are our stakeholders, our community, our patients in genomic PCOR. Also, they don't emphasize it as much now. They used to really want to see want you to talk a lot more about how it affects your region, your city, where you are. I don't see this in the most recent version, but we always emphasize kind of doing this work in Detroit and Southeast Michigan. Objectives, describe your aims and your goals, right? Clearly state the primary objective of your engagement effort. What specific steps will you take to accomplish your overall goals? So I tend to do this in two ways. I do this, and I have, like I said, I've been the project lead on 3 of these awards. I organized them in very, very similar ways. I always talk about aims. This comes from being a researcher because NIH likes to see specific aims, and the aims are kind of broader, right? So I talk about increasing capacity among African-American faith community stakeholders, identifying genomic PCOR priorities, and the aim 3 is about dissemination of the genomic PCOR priorities, because remember, they want to make sure that what you're doing is transferable and is relevant to other groups. So those are my broad aims, but then I always get down to objectives, and I usually have between 4 to 6 objectives for each of these, and these get to they are much more specific to kind of get down to brass tacks. So I said my objective 1, I'm adapting the curriculum, which is already a PCORI funded engagement tool, to address genomic PCOR. We are going to establish this council, which is going to be our stakeholders, 12 faith community leaders and representatives. We're going to train them and prepare them to contribute to all phases of genomic PCOR. Again, going back to their priorities. We're going to support this council in identifying genomic PCOR priorities. We're going to disseminate those priorities. And objective 6, we're going to support the replication of the capacity building effort. Okay. Methods and activities, the next area in the LOI, 1,000 characters. You don't have a lot of space and time. So to provide a concise description of the project methods and activities and strategies and how they support the overall goal. And I talk about how all proposed work will be conducted in partnership with the FBGRI, our community partner. And I talk a little bit about what we're going to be doing in terms of pulling together this Genomic Research Action Council, adapting the curriculum for genomic PCOR, and then the town halls through which we want to disseminate the information with the goal of increasing genomic literacy and public interest and engagement in genomic PCOR. And then we'll talk more about dissemination. And here, actually, I had a little nod here to evaluation. GRAC members will be asked to complete measures assessing the curriculum's effect on genomics and PCOR knowledge, as well as the evaluations already developed by, I have a typo there, by our team assessing their satisfaction with GRAC. And we're going to obtain evaluations of the town hall meetings as part of our dissemination efforts. We're going to obtain evaluations from the people who attend those town hall meetings. Our outcomes, important. So, and this is interesting because as a researcher, outcomes often mean something different in terms that kind of are related to, kind of your hypotheses and kind of findings based on statistical analyses. So this is a shift for me, kind of thinking about outcomes in terms of deliverables, which is more common in kind of foundation grants and this kind of work. So, but here, part of this is newer. They want you to talk about your short-term outcomes, your medium-term outcomes, and your long-term outcomes, and state their significance, right? In terms of clear deliverables and outputs. So we talked about here, we had 4 outcomes. The adaptation of the curriculum, that's an outcome because we physically have that as a product. The creation of a team of stakeholders through that Genomic Research Action Council who are prepared to advocate for genomic PCOR. The creation of a genomic PCOR agenda that is driven by the community, African Americans in Metro Detroit. And then we talk about, again, the development of a toolkit, again, to help with that dissemination. That's a product, an output to increase research capacity and involvement in genomic PCOR. So again, I keep driving that point home. I feel like you can't repeat it enough. Patient stakeholder and engagement plan. Again, this is really important. Again, hopefully I've shown you how important engagement is to all of PCORI's, work and their mission and their vision. So summarize your plan, 1,000 words, explain who your stakeholders are, what, if any, pre-existing engagement has taken place, how they will be engaged. They want to know also, this is important, so you can't really do these LOIs last minute unless you have really strong partnerships already, because they want you to describe how stakeholders and the organizations they may represent were involved in developing the proposed project and developing this LOI, right? And how they will continue to be involved. So I talked about our model. Our HealthLink model is already based and guided by the use of a participatory research approach. But let me take you to the bottom here. We were able to say, because remember, I already had this connection. We already had this connection with the Faith-Based Genetic Research Institute. Engagement has already taken place through a partner in this proposed project, the FBGRI, because they were conducting their own town halls and their own work in Detroit and in Oakland, California. So we talked about that. In terms of stakeholder involvement in developing the proposed project, FBGRI initially approached our institution and team to collaborate on a capacity building project. And we've worked closely with the team, FBGRI, to develop our project methods, and they will be key personnel on this project. Connection to PCOR and CER. So this is another part of the LOI, and this is newer. I didn't have to do it for the one in 2020, but I'm going to talk a little bit about give you some ideas about how to address it. So in the LOI, you have to explain the project's focus on and connection to PCOR and CER in 1,000 characters, how it's clearly focused and supports engagement in patient-centered outcomes research. Always has to come back to that. Your response should demonstrate an understanding of PCOR and CER. So I'm going to show you what I have done, at least, or approaches I've taken in my full proposals to kind of address this. And what I do is I like to give the reviewers examples of the kind of questions that are relevant to PCOR and CER. Again, most of my work is in cancer, so I draw a lot on the cancer care continuum. And I want to show them examples of these questions and how we need more patient and community voice in addressing those questions and in research that addresses those questions. So like in the first award that we successfully submitted, Preparing Detroit Communities to Advance Cancer Research, you can see what I had. I have some version of this table in a lot of my grants. I have the whole cancer care continuum from risk assessment all the way to end of life care. And I literally drew out questions that could be important. Some of this I took from Cochrane. You may be familiar with Cochrane reviews, because those Cochrane reviews are like kind of this literature reviews and synthesis of really important questions in healthcare. And I just gave them examples of questions where we would need community input. You can see it here I have on the left. To what extent are these questions informed by the priorities of cancer patients and their support networks? To what extent are these questions guided by the experiences of those representing diverse populations and medically underserved communities, right? So again, they want to see community and patient engagement in these types of questions and this type of research. So this is how I spelled it out. So hopefully I would encourage you to think about a model like this and so you can think backwards to answer that question in the LOI. Also show you how I addressed it in the Genomic Research Award that we've been talking about. So Figure 1 presents the examples of ways in which genetic and genomic information is used to improve cancer risk reduction and prevention, detection, and treatment as increasingly an integral part of cancer care and the emergence of precision oncology. And again, I give them examples like a key, perfect example right here, breast and ovarian cancer risk reduction, BRCA1 and 2 genes and genetic mutations increase risk of breast and ovarian cancer. There are a lot of really critical decisions that patients have to make. And how do you reduce risk? You can be thinking about prophylactic kind of chemotherapy, preventive chemotherapy. You can be thinking about prophylactic mastectomies. You can think about prophylactic oophorectomies, removing your ovaries. These are really important healthcare decisions, and we need to hear community voice in developing tools to help patients make those decisions, right? So that's how I've addressed that to some extent. Next, in the LOI evaluation, briefly summarize your plans for evaluation in 1,000 characters. This was not in the LOI that I had to produce, but I'm going to show you what I put in the full proposal. They're very helpful because they give you a whole reporting tool. And I gave you the website or the link to that. The goal for this reporting tool is to ensure that a standard set of indicators is being reported for engagement awards. So you should incorporate these outcomes or these evaluation indicators in your grant, but they're not limited to those indicators. And I'll show you. And basically, for those of you, you might know the re-aim model. That's what it is. It's just re-aim. So we talked about reach, how many people we would reach on an individual level, not only in our council of stakeholders, but also in the broader community. We talked about engagement, and we're going to track group participation in our council, like how many people attended meetings on average, and the proportion of regular meetings attended, and also tracking our dissemination efforts or engagement in our dissemination efforts. And that's just literally counting numbers, how many people attended and so on. And then adoption, how much did we were tools or resources that we developed as part of the project integrated into our community partners organizations. And then we also talked about assessing our kind of GRAC, our community partnership process, through a partnership assessment. We had evaluations of our curriculum and individual modules or classes within our curriculum. We have actually a kind of a validated measure, this genomic knowledge scale, that we're going to be incorporating in our assessment of our town hall meeting impact. And what we ended up writing, actually, because they do have a section for human subjects protection, so you could present it as research. But we said in ours that we were using this we're not trying to create generalizable knowledge. We're not considering this research, and therefore do not need approval from an institutional review board. I will say that if we decided to change that, you get when you're funded, you get a program officer, and you can discuss changes and adaptations throughout the course of the project as necessary. Sustainability, always a tough one, right? Describe your plans for sustainability. What I appreciate they have here, look at this first point. Describe how the project's outcomes contribute to the overall work your organization does, and how the outcomes may be adopted and sustained by your organization or project partners. Describe future opportunities, right? So oftentimes I do this. I often think about the dollars, right? How, if you don't, how do you make a case that you can get the dollars to support your work? But, there are other definitions of sustainability, right? In our proposal, we did focus a lot on ongoing financial commitment we have from Karmanos for community outreach and engagement. And also we've had a lot of success in getting additional extramural funding to continue this work. But be aware that there are different dimensions of sustainability. And I cited this Rabin et al. Article, which is like a dissemination and implementation article. And they talk about different dimensions of sustainability, to the extent to which you can deliver or continue a program after the external financial support has ended. I would encourage you to look at their concept or the construct of institutionalization, and how your work can be integrated within the culture of the organization, because that's meaningful too, beyond even the dollars that might be available to support the program. So I just share that with you so you can check that out. Additional project information, we're kind of coming down to the end. Budget. Let me talk about this. So you have to include a budget narrative about how you're going to use this money. For all grants, I recommend that once you have a general idea about what you want to do, draft your budget first, right? Because you might be surprised about what you really can do or what you're not able to do based on the dollars you have available. And I think it's always good to do this before you really confirm your collaborators or make promises to different partners. That's important for me. Again, for the capacity building award, it's $250,000 in total costs. What you have to be aware of is that the direct and indirect costs are combined in that $250K. If this was the NIH, you would get the indirect costs on top of the $250,000. So you'd be getting more than that, not with PCORI, it's combined. Just some other notes. You're limited to only 5 key personnel. So that's something that you don't see necessarily in other grants. And also they really focus and emphasize that you need to keep your personnel costs below 50% of your total project budget. Anybody who's written a LOI or done this work knows it's hard, very difficult to do. Most grants are personnel heavy. Most of the budget for most grants goes towards personnel. So this is hard to do. However, this is newer because they didn't give you this leeway before. Higher personnel costs may be considered with strong justification. Again, important here, compensate your stakeholders. Compensate your community members, right? We have to move away as academics. I'm speaking to the academics, that people are doing this just to be altruistic. We have to value people's time and respect their contributions. They are experts in this in different ways, just as we are. And they have actually really great guidelines for fair financial compensation on the PCORI website, a whole financial compensation for partners framework and budgeting for engagement activities. So again, it's on their website for a reason. You need to refer to it and reference it. They also in LOI, what is your organization's experience working with the populations you seek to engage? You need to provide evidence of established relationships with these stakeholders. So academic, again, for my academic folks, if you don't have this, start planning, start doing it, start cultivating relationships. It can all start with a cup of coffee. Using PCORI funded evidence and tools. So again, they prioritize work that uses previous tools, and they're going to ask you. So look around, they have everything, every project is on that website. You can go and find our projects on the website and find our final reports and see, you can read all about what these projects do. There's so much evidence. They value that, disseminating the work that comes out of the projects that they fund. There's a lot out there. And then, if yes, this is a little newer, describe the tools and resources selected and the justification for its continued and expanded use. And you got 3,000 characters for that. Most of these other things have been 1,000 characters. This is 3,000 characters. So you need to talk about it. And, for us, we again had models and a curriculum that we had already developed with PCORI funding. So we were able just to cite that work. So let's talk about the actually submitting it. I want to talk about authorizations for a lot of other grants. Certainly at Wayne State, you have to go through like the sponsored projects office, and there has to be a different level of review of your project and your budget usually. And so if something is due April 1st, you usually have to actually submit it a week earlier so it can go through that institutional administrative review. For the LOI, you don't need to do that. So if you choose to, you can work up until the last minute. You can push the button. You don't have, somebody else doesn't have to push that submission button for you. So that's just good to know. It gives you a little bit more time to work on it, although I wouldn't recommend waiting till the last minute. I just want to actually, in closing, share like the full proposal, right? And 2 key templates. The project timeline, first of the work plan and timeline. So it's 15 pages. In the guidelines for this, to prepare this, you will see they have rules about the fonts, the spacing, the margins. You'll see all that stuff. So pay attention to that. But again, you can see all the areas are the areas we talked about: the background, the objectives, the methods, the outcomes. So you really just have to expand upon what you wrote about in the LOI. But also your project timeline is really important. And I'm going to talk about that because there's a whole piece about milestones that is really important to pay attention to. Your patient and stakeholder engagement plan, limited to 2, you got 2 pages to talk about all about what you're going to do. Again, use their resources, take it seriously. And then even after you write all that, you have to write a lay summary. So they're asking you to kind of do a lot. Again, protection of human subjects can be in there. Your subcontracts, you can have subcontracts as part of this as well. But then I want to share with you the milestones. You got to be careful about this because, again, PCORI is going to give you a contract. It's not a grant. Then you're going to put dates. They're going to talk about milestones and specific deliverables. You don't want to overdo it because you actually have to provide this to PCORI. And you're going to have due dates for this. And what they're going to do in their contract is they're going to give you like 5 different dates where they're going to kind of dole out the $250,000. You don't get it all at once in the beginning, like a NIH grant or some other funding agencies. You have to meet the milestone, then they'll give you the money. Then you have to meet the next milestone, then they'll give you the money. Okay, so you got to be ready for that. So again, there are contracts, not grants. There's a high level of accountability in terms of deliverables, and a lack of follow-through on deliverables could jeopardize the receipt of the full award if you're getting all the dollars. So just about it. So I just want to share some information about some advisory panel applications and nominations that are ongoing. For other areas, they value community input, and these are ways that you can get involved with PCORI outside of the funding. And I just want to thank everybody for your time. Here's my email address, and I'm starting to have office hours at the iBio building on Woodward Avenue between 3:30 and 5:30. And so I try to keep those times open if you want to talk and connect and consult.
Great, Haley. Thank you. We do have one question, and I just want to make a note to everyone. The evaluation link is in the chat, so please do fill that out so we can talk about. And just to reiterate a few key points that Haley made, I can't stress enough how important it was that she told me to start with the budget and engage community members yesterday, before you start. And also, I just wanted to mention that I did apply. My LOI was submitted last October, and I was able to submit my full application in January. And over the holiday break, I had COVID or flu-rona. I don't know. It was like a 2-cycled thing. And I wasn't able to submit my full application. And Haley did advise me to seek a deferment. And it was a pretty easy process to submit a letter to say, you know, this is where I'm at and the barriers to submitting. And I was able I was granted that deferment so I can apply in the next cycle. So
Which is
this
important.
the,
So you don't have to submit that LOI again, because if you
right,
hadn't done that, you would have to submit the LOI again. Now you don't have to go through that.
right.
And you know, it's no compensation for Flurona, but you have a little bit more time.
Yeah. And Haley, I just wanted to say, I have a few comments here,
Yes.
and people can log off as they need. Megan Landry is saying, I would love Dr. Thompson's thoughts on if she sees a place for American Cancer Society in these grants. And also, would she be willing to do a presentation like this for her peers on how to apply for ACS research grants?
I think yes and yes. I mean, I don't see any reason why the American Cancer Society, which is a funder itself, you know, can't apply for PCORI funding or partner with organizational PCORI funding. That's interesting. And that's something maybe to explore in more detail, but I'm not, you know, American Cancer Society is eligible. And I'd be very happy to talk about what I know about American Cancer Society Research Scholar Grants. So again, this is the first kind of workshop as part of Checkup, this emerging new Center for Health Equity and Community Knowledge in Urban Populations. We're excited. We plan to do more of these. Again, we want to get more people involved in these. We want to see more of this work coming through Detroit. We want to see, and in Michigan, we want to see more of this work coming through Wayne State. So happy to do it.
Okay, great. And I would just end by saying we will follow up with the slides and the video next week. And also, Haley has graciously offered to hold office hours to support people in creating these LOIs. So I would just say take advantage of that. She's a resource and support for these applications.
Carrie, if you're willing to, I'm willing to stay on like 5 or 10 minutes later, you know, if people have questions. Is that okay? Are you okay with that?
Yeah, I have another actual comment
Okay.
that I have in the chat here. So
Cool.
we'll say thank you to those who have to run. We don't want to keep anybody here, but we will stay on for a few minutes. And do we want to I want to thank Julie O'Connor and everybody at the OG staff, and Forrest especially for helping us
Forrest.
bring this together. So Forrest, do you want to go ahead and end the recording at this point? And then
let's keep it going. Keep it going.
Oh, keep it recording.
Yeah.
Cancel that for us. Thanks everybody for being here. And I will just read what we have in the Q&A box then for you, Haley. And it says, this is my 4th year of being a consumer reviewer, peer-reviewed cancer research program. Oh, it's just a statement from somebody's acronym that says JRSMA. So I don't know the person's name, but just saying this is our 4th year and being a consumer reviewer for cancer research. So thanks for sharing that. And I'm going to go through the chat here and see if there's any questions here. We have a lot of thank you for your generosity and sharing your experiences. Are there more than one LOI requests per year? That's a great question.
Yes, typically.
Is it
like
3?
2 to 3?
I think it's a cycle of 3, but I mean,
sometimes, again, PCORI changes things up. So, but I think the next one, this is the April cycle, and then I think there's going to be an October cycle. Again, trust me, it's all on the website. Go into that website.
Okay. And I just can't stress enough, even for individuals that are interested in community engaged research, I think that website has just, like you mentioned, the financial compensation framework. That's something we use in our own work and can apply to anyone doing the work. So even if you're not going to apply for this, PCORI has some excellent resources for building the capacity.
And they're growing it. They're growing these resources. There's so many.
Yeah. Oh, and Jim Scott is the consumer reviewer.
Oh, hi. Hello. Hey, Mr. Scott.
Thanks. Okay.
He's part of our Black Men's Cancer Action Council, so he understands kind of the nature of this work. Yes.
Okay. All right. Well, we don't have more questions.
Oh, okay.
So
yeah, and again, if you want help, also this is part of my work and Carrie's work. If you want to connect to community stakeholders, and we can help facilitate introductions and help you build those relationships. You know, just yesterday, you know, for Dr. Daly, you know, and she was already familiar with this community group that deals with perinatal health. But you know, I happened to have a separate meeting with them, and I said, hey, wait a second, Dr. Daly wants to do this work. You want to advance this work, and they were asking me about our engagement models. It's like you two of you need to work together. Right. So hopefully that will come to fruition, and, you know, but we're happy to kind of make those introductions. I love making these connections.
Okay. We do have another question from Rhonda. She's saying, how many meetings do we need to have with stakeholders before we submit the LOI?
So I don't know if it's a number of meetings. I mean, you have to demonstrate relationship. Right. So I think anything you can do is good. The more, the better. Right. because you saw what they wanted there. You saw what they asked about, an established relationship. So, and you know, you can define that in different ways. I think what's most important is that you make the case that your priorities are aligned and that they have real substantial input into this idea. That's, I think, the most important piece. You're going to say, Carrie.
That part that that you stressed in your slides, it's like you have to talk about how your community stakeholders were involved in the development of your LOI, right? And so that it depends on how long does that take to decide on that. Thanks, Rhonda. Okay, great. Any other questions? Otherwise, we will bid everyone a safe Friday in
Thank you, everybody.
Snowy winter and conclude. Thanks, Haley, so much.
Thank you, everybody. We appreciate your participation. Really grateful for your support. Bye.
Bye.